Hello, welcome on my channel Charming Science. Today we are going to discuss about the scapula bone. So according to the structure, scapula is a large, flat, roughly triangular bone that is present upper part of the posterior lateral aspects of the thorax. If we are going to see the body, it's a thin triangular shape. When we are going to for the side determination, we see that on the lateral side, this is the lateral view. Let me mark it. On the lateral view, we see that it's a glenoid cavity that is present. When we are going to determine the size, we see that on the lateral view a glenoid cavity will be present. On the dorsal surface is convex and is subdivided into a triangular spine. When we look into a dorsal aspect, we said that it's a little convex and having a spinous process. This is the dorsal surface, and the spinous process divided into the supraspinous fossa and the infraspinous fossa. The thickest, the lateral border. The lateral border, we see it in a posterior view. Then we see that the lateral border, this one is the lateral border, sorry, this one is the lateral border. This border run till toward the inferior angle. So by this method we can decide the which side or determine the side of the scapula. That's on the lateral view, it's having the glenoid cavity. On the dorsal surface, there is a spinous process present. That's all. So when we are going to talk about the bone, let me remove all the marks from it. The scapula having the two surfaces, that is the dorsal surfaces and the costal surfaces. This one is the dorsal surface images. This image is of the dorsal surfaces and this image is of the costal surfaces. The dorsal surfaces image lies dorsal mean that the which lie on our back is the posterior view, and the costal surfaces or the anterior view is the first one. It's having the three border. The superior border we can see in the superior view, that it is the superior border that is forming. Let me mark it correctly. Yeah, this is the superior border which is present on the scapula. It's having a lateral border, which is the lateral border we can see here. This is the lateral border, and we have the medial border. Medial border, this side. This is the medial border which lie, this also a medial border in a posterior view, which lie toward the vertebrae or the spine of the body. It's having a three angle. Let me draw the angle in a different color. It's having the three angle. There are the three angles: superior angle, inferior angle, and the lateral angle. So inferior angle, it's lie here in the posterior view. In the dorsal view or the dorsal surface, it lies at the below the superior level. This is the superior angle, and beneath the spinous process, it's the lateral angle is present. It's having a three processes. It's a large flat bone, so it's having a major structures. Let me make it pink, blue. Yeah, so it's having a three processes. The first one, this is the spinous process that is present. This acromion processes, and in the anterior view what we see, it's a coracoid process. So this is a general overview of the scapula bone, that what are the things present on it. Let's come and see on the And one of the major important thing that I want to tell you that the load applied through the glenoid fossa, whenever we are going to apply, when just imagine there's having a bone, that is a humerus will be present here of the upper limb. So the load applied through the glenoid fossa or through the coracoid is transmitted into the scapula through these columns. Through these column means that the acromion process and the coracoid process is the major one that transfer the weight of the upper limb to the scapula. If we are going to see the anterior aspects or the costal surface of the scapula, then we can see, first of all I have to draw it. The origin one I will mark it in red, and the insertion one I will mark it on with the blue. So first point, this is the insertion of the attachment of the trapezoid ligament. It is the attachment of the trapezoid ligament that is present on it. First one is the trapezoid ligament. Wait, ligament I will mark it by the green. This is the attachment of the trapezoid ligament. This is the first one. It is present on the coracoid process. Anterior aspects of the coracoid process. Attachment of the conoid ligament that is present beneath the trapezoid ligament. The third one is the acromion processes. The whole structure that is present, I will mark it with the this is the structure that I have told you that it's a whole structure that is present here. It is a acromion process. It is the whole structure is known as the acromion process. Suprascapular notch. This is the notch. I will the green one. This structure for the this is known as a suprascapular notch. This is the origin of the muscles. Here the omohyoid muscles will originate. Omohyoid muscles, inferior belly of the omohyoid muscles will originate from here. The serratus anterior muscles. This is the place it is the insertion of the serratus anterior muscles will take place here. We'll draw it with the blue. Insertion of the serratus anterior muscles. This is the insertion of the subscapularis muscle that is covered the approx all the costal surfaces of the scapula. Ridge of the intermuscular tendons of subscapularis. Here are you can see there are the some ridges that is present on a costal surfaces, that is sorry it's going to be very long. There's the surfaces where the tendons of the subscapularis muscles or the land is these are the landmarks which are present on the costal surfaces for the attachment of the subscapularis muscles. There the another one is the deltoid. If we see that the deltoid muscles is present here. deltoid muscles is the present here. The short head of the biceps brachii. This is the short head of the biceps brachii and the coracobrachialis that are originating from the same places. The pectoralis major. The another is the origins of the pectoralis major. 12th is the glenoid fossa that is present laterally, and the 13th one is the long head of the triceps. These are the 13 landmarks which are present on the surface of the costal surface of the scapula. So if we are going to the theoretically, then we can see that the costal surfaces have the upper part matching the contour of the chest wall. The scapular fossa comprises nearly the whole of the costal surfaces. That is present only, including the grooved area immediately adjoining the lateral bone. Small fibrous intramuscular septa are attached to 4 or 5 roughened ridges. This is the ridges that is I am talking about, that subdivided the surface incompletely into a number of smooth areas. The lower 5 or 6 digitation of serratus anterior are attached to an oval area near the inferior angle. The longitudinal thickening of the bone near the lateral border provide a column of the necessary strength to withstand the pull of the serratus anterior and an inferior angle during scapular rotation. When the glenoid cavity is turned to face more directly upward, the arm is raised from the side and above the carried gravity. When we are going to look at the dorsal surfaces, then first of all we see the clavicular facet where the clavicular bone is going to attach. Second is the attachment of the origin, we say the origin of the short head of the biceps brachii. Third one is structure is the acromion process. The fourth one is the origin of the deltoid. Fifth one is the glenoid fossa. It's a landmark. Triceps brachii long head is originating from the middle border of the lateral border of the scapula. Seventh and ninth, this one is the teres minor muscles. These are the attachment of the teres minor muscles, and between the two teres minor there is the groove of the subscapular artery from where the subscapular artery will go or pass from it. The 10th one is the teres major origin. 11th, it is the conoid tubercle that is present where the ligaments is going to attach. 12th one is the coracoid process. 13th one is the origin of the omohyoid muscles. 14th is the superior angle that is present, it is as a landmark. 15th is the supraspinatus. This is the origin of the supraspinatus muscles. 16th one is the levatary scapulae, origin of the levatary scapulae. 17th one is the spinous process of scapula. 18th, it is the origin of the, or we can say the insertion of the trapezius muscles. 19th, rhomboid minor will originate from here. You can say insert, rhomboid minor will insert from here. 20th, it's the place for the infraspinatus muscles. The 21st is the rhomboid major, and the 22 is the latissimus dorsi, and 23 is the inferior angle of the muscle, inferior angle of the scapula. If we are going to see the lateral aspect of the clavicle, then we will see that the coracoid process is present here. The supraglenoid tubercle, it is present here. glenoid fossa, infraglenoid tubercle for long head of triceps brachii, origin point. This is one is the ventral surface or the anterior surfaces. Eighth, eighth is the lateral border. Ninth one is the inferior angle, acromion, and this one is the seventh one is the acromion angle that is present on the scapula. If we are going to see the superiorly aspect, then again we will say facet for the clavicle bone, acromial process, spinous process of scapula, its superior border, head of the coracoid process, glenoid fossa. Sorry, it's the head of the glenoid fossa and the glenoid fossa. Seventh one is the neck. That eighth is the conoid tubercle for the conoid ligament. Ninth one is the coracoid process, and tenth one it is the attachment of the trapezoid ligament that is present on it. That's all for the landmarks and the muscles attachment of the scapula. If we are going about to talk about the ossifications point, if we are going to see tell about the ossification point, then the cartilage of scapula is ossified from 8 or more centers, one in the body, 2 each in coracoid process and on the acromion and on medial border, inferior angle, lower part of the rim of the glenoid cavity. The center for the body appears in the 8th intrauterine week. Ossifications begin in the middle of the coracoid process in the first year or in a small proportion of individual before birth. The process joins the rest of the bone about the 15th year. Soon after puberty, center of ossification occur in the rest of the coracoid process. In the rim of the lower part of the glenoid cavity, frequently at the tip of the coracoid process in the acromion, in the inferior angle. The glenoid cavity usually the upper third is ossified from the subcoracoid center. It unites with the rest of the bone in the 14th year in the female and the 17th year in male. It converts the flat glenoid cavity of the child into the gently concave fossa of the adults. The rest of the acromion is ossified from the two centers that unite and then join the extension from the spine. The various epiphyses of the scapula have all joints bone by about 20th year. The normal fetal scapula differentiate in somatic ectoderm at about 5th week in utero, juxtaposed to 4th, 5th and 6th cervical vertebral alignment. As the neural axis and the cardiac primordia develop between the 9th and 12th week, the primordial scapula migrates quadrily to its usually position at the level of the 2nd and 7th ribs. That's all for the scapula. Thank you.